Good morning, everyone. I would like to welcome and thank you all for joining this webinar with us today. I am excited to introduce our presenter, Ted from Wellcare. Ted is here to share some of his valuable insights with us, and we're looking forward to his presentation. And this will be recorded, so I will send this out at the end once we end at the beginning. But again, thank you, Ted, for being with us, and you can go ahead and present.
Thank you so much for having me today. Today we are going to look at Wellcare, kind of a review of our lock-in and OEP hotspots with a focus on the South region with us. I know many of us are here in Florida, but depending on where you are or if you use your telephone for sales, right, we can bleed up north. So wanted to touch a couple of the states that are interesting for us and possibly that you could be marketing in. So to start off, I want to let you guys know that we have a lot of support out there for you. So this is our national distribution team. So this team works with our national agencies like AmeriLife, and their downline agencies. So anyone here on the screen, you can definitely reach out to. As you can see, we're located across the country, from Tammy out in California, Jan up in New York, Elliot in Connecticut, and we have James in Illinois, and then myself here in Florida. So, but we, as a team, kind of cover the whole country. And then we have our local Florida managers here in the state. And here in the Tampa Bay area, we have Gus, Yanni, and Julia. Up in the Panhandle from like Tallahassee over to Pensacola, we have Julie Anderson. And then in the central part of the state, which is the Orlando markets and the surrounding counties, there's Danny, Maria, Arturo, and Susanna. Jacksonville, we have Sharon Rogers up in that part of the northeast Florida. And then down south, southeast, so Miami-Dade, Broward, up the East Coast, we have Jose and Joe. So anyone here on this screen can help you with questions or marketing efforts and so forth throughout the state of Florida. So again, a great resource for you here as well. I mentioned the regions and kind of concentrating on the South. Excuse me. So here's just a quick map of where how Centene Wellcare breaks down the country. So the South there in hot pink is where we're kind of looking at today, along with the West Coast, Central, and up in the Northeast. On this slide, we have QR codes for our first looks for our plans across the country, as well as other sales contacts, so local managers and other sales leaders throughout the country. Again, if you're marketing outside the state, a great resource to find out who locally can help you with questions or concerns. So just a quick snapshot, again, of the southern states for 2025. This slide kind of shows where we were for OEP, and then currently through lock-in, kind of the top states in order. So as you can see, Texas, typically one of the top 3 states in the country as far as production. Florida here in the South, number 2, along with Georgia. And then we have North Carolina, Mississippi, South Carolina, and then Louisiana. And as you can see, as we look at both OEP and lock-in, kind of those order of the states kind of remain the same. So again, Florida, a great opportunity here, sitting at number 2, along with Georgia at number 3, right? If we jump up into southern Georgia. So a couple things that we did want to touch base on too, some of the election period changes out there, and this new integrated DSNP SEP. I know hopefully a lot of you have gotten training on this, but just to kind of quickly cover this, since again we are in lock-in, and I know this plays a big role, right? Marketing to duals and so forth. Just want to touch base on this. So with the new integrated DSNP SEP, This is for full duals only, right? So our FBDEs, Quim B plus, Slim B plus duals, they get a new monthly SEP, right? If they are enrolled in Medicaid MCO from the Centene brand and have an integrated DSNP plan available in their service area. Do want to partially touch base on this. So there are a couple states, Florida being one of them, where it's a little bit different. We'll touch base on that here in a minute. The partial duals and LIS, so they are losing their quarterly SEP that they had last year. That no longer exists. So they may choose an available DSNP or Medicare plan during AEP, MA, OEP, or their initial election periods, or any other valid SEP which they may qualify for. So the partials and duals aren't going to be able to utilize the new integrated SEP. They're really treated like any other beneficiary out in the marketplace. And since we mentioned that any other valid SEPs, do want to point out here that a change, gain, or loss of LIS or Medicaid level or coverage is still available. So again, when an individual becomes eligible for LIS or Medicaid, if an individual loses their LIS or Medicaid or Medi-Cal if you're out in California, or there's a change in their level or status, those are still valid SEPs out in the market. So we can still utilize those for an effective date of the first of the following month. Here's our footprint that coincides with that new integrated DSNP. Again, I mentioned Florida is one of the states for 2025, along with 12 other states across the country this year that have the available DSNP plans in their markets. You can see here there's a couple different options when it comes to those plans. And really, they just vary on what those plans need to cover from a Medicaid benefit aspect. So as I mentioned, hopefully you guys have gotten lots of training, so I don't want to dig too deep into this, but we do have a resource out there for you all that kind of goes through a presentation of the new rule. Again, goes over the states, gives you some different scenarios, real life scenarios that we think you could come across out there selling and what to do in those different situations. And then again, the CMS rules and opportunities by those states that we have for this year, links to all of those. So the link here at the top of the page, the Wellcare resource link, is how you get to this. And again, I'll be sending this out to you guys, so you'll have all these slides and links to access. One thing that we are doing when it comes to the new SEP is trying to help you guys figure all that out when you're out there selling. So again, to avoid member abrasion, rejected applications, we want to give you all the resources and information at the time or prior to submission of an application. A couple of the resources that we have is our special populations team, so the SPOP line, and you see the number there on your screen. You can give them a call, and they will have the information as to the beneficiary's Medicaid plan. So even if the beneficiary is not a Centene Medicaid member, they'll have the information of who they're currently with. So you'll have that information to know if you need to change that Medicaid plan in certain states, to move them to a Wellcare DSNP. They will also have visibility and be able to provide you guys if the beneficiary has long-term support services through their Medicaid plan. This is going to be important, again, especially here in Florida, and we'll touch base on that here in a minute, but they'll be able to provide that to you as well. And then the question that we had in a prior training was, does Wellcare auto-assign Medicaid MCOs, right, or a Medicaid plan, or can help with changing the Medicaid plan if the beneficiary is needing a change. Unfortunately, the SPOP team won't be able to help the beneficiary or yourself make that change to their Medicaid plan if needed. That's something that they would need to do on their own. Again, we have some resources, as I mentioned, as far as links to state Medicaid sites, links to our Centene Medicaid companies across those 13 states that help you as needed if we're needing to make those changes. Excuse me. The other tool that we have is also our Ascend online enrollment platform through Ascend, which, as you can see here, is open 24 hours a day, 7 days a week. You can verify all this Medicaid eligibility as well. This picture gives you our current Centene Medicaid footprint. So the states highlighted here gives you an idea of where we are as far as our Medicaid plan and footprint. The reason I want to show this to you guys, obviously this is a little bit different than the 13 states that we are showing for this year with our integrated DSNP plans. But the future looks bright here, right? As we move into 26 and 27, we are going to be rolling out more integrated DSNP plans throughout these states where we have Medicaid available. Excuse me. A couple strategic alliances that we have, again, across the country, but Florida being one of the leaders when it comes to this, is with our American Legion partnership. As you can see here, the Legion is the nation's largest veteran organizations with more than 1.6 million members across 12,000 local posts throughout the country. Again, Florida has a large number of posts throughout the state, and this is a great opportunity for you guys to get out in the market and work with our community service team and these Legionnaire posts to provide Medicare Advantage plans to the Legion members. What kind of opportunity are we talking about? As you can see here, there's over 1 million Medicare eligible members in our service areas where we're selling our Medicare Advantage plans, and the American Legion post are. Current membership right now, you can see there, and this slide is a little bit old, so these numbers have probably gone up a little bit. Again, this relationship's about a year and a half old, so continuing to grow this with us. And again, the way to get involved here is through our community service team. They sort of have the relationships built with the local post, and they can help you get involved if you'd like. To get in touch with our community service team, again, I would kind of direct you to our local managers. Again, they're working with that team in conjunction with agents within the market to help them get involved. So let's talk about some supplemental benefits. I know with plans, right, this is obviously these benefits have been big year over year here the last couple of years. So just wanted to touch base on where Wellcare stands with our Spendables card, these all-in-one cards that are out in the marketplace, and kind of give you an idea of how we compare to what's out there with our competitors. So you can see here with our Spendables card, it's one card that can provide over-the-counter home improvement and safety items, which is new for this year, utilities assistance, rent assistance. Hearing, vision, and dental was removed for 2025 from the Spendables card, but we do still have some great core benefits that are still within our plans for these additional benefits. We also have gas pay at the pump and healthy food. A couple things that make I think our Spendables card really competitive and different from others is that the member, if they have access to all these benefits based on their plan, will have a monthly benefit that they can utilize and on all the benefits included in their card. So we don't preset limits for each benefit, which I've heard some competitors do. The member gets to choose how they want to spend their money on what benefits. Also, our cards, most of our cards have rollover benefits from month to month. So whatever they don't use will roll over into the next month. And then, as you can see here, one of the other things that we've seen with the gas pay at the pump and the healthy food and the OTC, again, these benefits are all included, where some of the other carriers' cards include some or just some of these benefits, right, but not all. As I mentioned, some cards have rolling benefits and some do not. So here for 2025, our DSNP plans have the monthly rolling benefit and include the home improvement and safety items, the gas pay at the pump, the healthy food, the utility and rent assistance. Again, as I mentioned, it's a single purse benefit that the member manages as they see fit. Our non-dual plans include OTC benefit only, and that is a quarterly amount which does not roll over with the OTC and non-dual benefits that have the card. So to dig in a little bit more about some of these benefits, the home improvement and safety items. So again, this is managed by Soltran through approved product list offered through Walmart. Will include items such as non-slip floor coverings, grab rails, air quality equipment, pest control sprays, and more. We also have the Amazon over-the-counter and healthy food fulfillment. So this is something cool that I think we started this last year. But members shopping for OTC items through Healthy Benefits will receive their items through Amazon. And to be able to help our members, basically what we've done is we've included a Prime membership that gives them enabled shipping, Amazon branded products, and there's not a $35 shipping minimum. Again, this Amazon membership is included with their plan. So there will be an external link on Healthy Benefits to access the vendor shopping experience. And again, $35 minimum order for free shipping will still apply for Walmart orders, right? So if they're using walmart.com, that $35 shipping will still count there. Uber Eats. So members can use their allowance dollars towards OTC and healthy food and have Uber Eats deliver those items to them. One thing to point out here is that when utilizing Uber Eats, they won't be able to order a burger and fries from McDonald's and have that delivered, but they, again, can have healthy food delivered from the different providers and their OTC by Uber Eats directly to their front door. And then we have our Healthy Foods program. So this is really not new through Mom's Meals. So if the member has a chronic or post-acute benefit with their plan, again, Mom's Meals will provide that benefit to them directly to their home. And again, these are prepared meals and produce kits that are in addition to their Uber Eats stuff. Retailers. So again, we have Walmart, walmart.com, CVS, Walgreens, Kroger, Dollar General, Albertsons, Ahold, Delhaize, and Rite Aid. New for this year, we picked up Sam's Club, Meijer, and Top Schnucks and Marks. So there's 66,000 retailers across the United States, and with store-to-door, same-day delivery, 5,500 cities have that benefit. And again, you can see here, a lot of the favorite chains and local stores are available through their Spendables card. Dental. So here in Florida and really across the South and the country, our core dental benefit plans are some of the best that we've seen out in the marketplace. With our D-SNP plans, we're looking more towards the right of this slide with our platinum and gold benefit packages. What makes the platinum so competitive is it does include dentures and implants, and there is no maximum annual benefit dollar amount for the members to utilize. So basically, they can utilize every benefit that's listed on their dental plan throughout the year if needed. With the gold and moving down to your left, these plans do have comprehensive dollar maximums to these plans. But the one cool thing, as you see here, any preventative services, right, like cleanings, fluoride treatments, and so forth, x-rays, do not count down the dollar maximums. Again, those dollars are set aside for comprehensive services like your fillings and extractions and so forth. And our gold and silver plans do include dentures, but no implants for those types of benefit plans. Wanted to show you TWIL. Again, this is a new benefit for 2025. And again, in the news and out there in the world, right, we're hearing a lot about mental health. So this is something that we've done for 2025 that allows our members to get services through the internet, right, over their smart devices. So you can see here if their plan has this benefit, an activation link will be provided to the member to download and sign up through their smart devices. This is a delivery through digital-led care. So again, that digital platform. And some of the things that we've seen here, right, with this is that members or beneficiaries, right, are a little hesitant to go face-to-face to try to get this mental health care, whether it be in a one-on-one setting or group setting, which typical benefits are lead members to. Here, through the comfort of their own space, right, they can log in and get the help that they need on a personalized level. So again, I think this is a great benefit. And this is something that when we're talking to the veterans and the Legionnaires out there, something that's high on their radar as mental health right now, and that demographic of beneficiary is really in focus. So something to keep in mind. So let's talk about the South region. So our portfolio approach here, as we look throughout the South, we do still have Part B premium give back plans, where here in Florida, that is still a great option, we feel. We did make some changes to that plan to make it a little more competitive from where we were last year. We think the give back plan, as you can see here, is really for value conscious beneficiaries who are seeking some or all their Part B premium back and willing to trade off other benefits to get that Part B help. So this is an HMO available option here in the state of Florida. And then we have budget friendly core plan, which is our Wellcare Simple plan. This plan has very low copays, low hospital, inpatient hospital, right? So these are really for beneficiaries who are seeking those predictable costs every month and are higher utilizers, right, of those benefits. And with our simple plan for 2025, it does come with our platinum dental plan. So again, here, our members have access to dentures and implants and a no max dental plan core benefit plan. And then we have with the veterans new for 2025 here in the state of Florida, and really throughout the country. We have our Wellcare Patriot Give Back Plan. Again, this is for beneficiaries who receive credible Part D coverage through a retiree plan, VA benefits, and etc. So these are MA only plans, so they do not include drug coverage. Some plans, as you see here, also include give back. Some are all of their Part B premium. And again, this is an HMO option as well here in the state of Florida. So looking at the state of Florida, you can see here, we do have a couple of suppressed plans up in the panhandle, really from Pensacola through Tallahassee. And those are core give back and simple plans. So in the panhandle, where we're seeing a lot of sales currently is, again, with that new MA Patriot plan, as there's a lot of veterans up here in the panhandle, especially in the Pensacola with the base up there, as well as our dual plans are great options up in the panhandle. Throughout the rest of the state, we're seeing, again, kind of a mixture, a 50-50 split of plans, really still seeing the simple plan mixed in with a couple give back plans, but then our two DSNP plans, our Liberty and our dual access throughout the state are very key options. Also shown here are kind of the counties throughout the state, top counties, as we see Orange, and which is Orlando area, and then Hillsborough, which is Tampa Bay, Duval's over in Jacksonville. So again, kind of that central part of the state down in southeast, Miami-Dade and Broward, and then Duval's, as I mentioned, was Jacksonville. A couple of things to point out in the state of Florida, since we do want to kind of focus on this, is that our provider network throughout the state is one of the most robust networks we feel in the marketplace. Something a little maybe a little unusual and newer for Wellcare. Members can cross counties and even state lines on our HMO plans that we have available through our Wellcare network, multi-state network. So meaning if, with our snowbirds and so forth, if they go up north for the summer, their benefit plan, even though it's an HMO, will go with them, and they'll still have access to all the benefits of that plan. One of the key things with that, though, is that when they're out of their service area, they do need to find an approved Wellcare provider in the area that they're at, and they can do that online through our provider search tool. Very, very simple to use. Don't have to tell us they're ahead of time that they're, going up north or what have you. So a really cool benefit for our HMO members and our members here in the state of Florida. Our formulary on our plans, again, in many cases, is going to be more competitive than most of the other options that beneficiaries will see out in the marketplace, meaning that the drugs being covered, also at what level they're being covered. So again, our formularies on all of our plans, again, the last handful of years has really kind of set our plans apart, we feel. And so doing that needs analysis and comparing their drug costs can be a big thing with our members and saving them money month to month on out-of-pocket expenses. As I mentioned, the simple plan has that platinum dental, no max allowance, right, with the implants and so forth. Our Wellcare Liberty plan, which is an integrated option here in the state of Florida, again, is a great option with offering $190 on the Spendables card per month, which rolls over if unused. And as I mentioned, it includes all those great benefits with pay at the pump, gas plus utilities and rent, and zero copay on their prescriptions. The Wellcare Access Plan is the other integrated dual DSNP here that can be used with the new SEP. Again, with that access plan, there's $175 on their spendables card, again, with all the same benefits as mentioned with the Liberty. The dental plan is that gold option with a $5,000 comprehensive benefit, again, with the NOMAX preventative benefits being offered with that, and again, a zero copay for their prescriptions. One thing I do want to point out here as we're talking about these plans, and especially with the Wellcare Access, if you look at our first look page and see with the access, it does cover the full benefit duals and the QMB and SLMB plus, which makes it eligible, right, for that new DSNP SEP. But in reality, if you have a member that falls within one of those levels of Medicaid, they really should be put into our Liberty plan because, as I just mentioned, right, with the higher benefits for the spendables card and the dental and so forth. Even though our access plan will still allow that, kind of doing a disservice to that beneficiary by putting in there if they do qualify for the Liberty. Also, the access plan does allow our QMB level of Medicaid beneficiaries access to that plan's benefits. But again, those beneficiaries do not have the ability to utilize that new SEP this year, right? So please keep that in mind. One other thing, as we talked about with that new integrated SEP here in the state of Florida, the state has made it a little easier for us when it comes to this new SEP. So we do not have to coordinate or integrate, if you will, the Medicaid plan for the beneficiary with their Medicare DSNP plan. So here in the state of Florida, when a dual beneficiary, moves into the DSNP plan, their Medicaid benefits roll into the Medicare DSNP plan. So they basically are kind of losing the Medicaid side of it because the Medicare DSNP plan is going to pick up those benefits. Now, remember I mentioned when we're verifying on the Medicaid side, those long-term support services on the Medicaid benefit side. Here in the state of Florida, our plans are, as I mentioned, are highly integrated. So to be a highly integrated plan, those plans either have to offer mental health benefits or those long-term support services. Wellcare has chosen to offer the mental health side of things, as I mentioned, with that new TWIL benefit. So if a Medicaid beneficiary, a dual beneficiary, has those LTSS benefits through Medicaid, then that's the one exception here in the state of Florida where you would have to transfer their Medicaid plan to our Sunshine Centene plan in order for them to keep those LTSS benefits, because our DSNPs are not going to cover those for them. What else here? As I mentioned, here in the state, the Wellcare Patriot Plan also has, depending on where you are within the state, a give back on their Part B, along with some low copays and as well some great ancillary benefits, right, for those veterans or members that are looking at that plan. So that is the state of Florida. Here's a quick slide on the network here in the state. So let's talk about Georgia real quick. As you can see here, Georgia, we're in most of the counties throughout the state. with Fulton, DeKalb, Richmond, Muskogee, Lowndes, Chatham, Carroll, Gwinnett, and Clayton are top counties where we're looking at. And then within those counties, the plans that we're looking that are selling, right? So the Wellcare Simple plan, as I mentioned, the Wellcare Dual Liberty, the Give Back, right, is what we're seeing here in the state of Georgia. Where we win here is, again, we have extremely competitive core plans, which is that simple plan with strong ancillaries, as I mentioned, here in the state of Florida, and low specialist copays. Also in Georgia, our MA only plan, so they do have the Patriot plan as well up there, and that's really attractive with 2 product offerings in that space. So again, an HMO option that has 0 specialists and strong ancillaries with a $5,000 dental combo, and a PPO option up in Georgia as well, again with $115 give back with some great valued ancillary benefits as well. Again, the Spendables card in Georgia works the same way as here in Florida, with the benefits being offered and so forth. So again, within Georgia, some great opportunity up there as well with the plans that we see here, along with the Patriot plan. Again, provider network throughout the state, kind of an overview there. And again, something to point out, we do include the link to our Find a Provider on all these provider pages. So again, once you get this presentation, you'll have those quick, easy links to each of those. Louisiana, as we move a little bit over there. So Louisiana, as you can see, here has the dual access and the dual liberty, but this is not one of those integrated states. So out there, members do not have access to the new SEP, as well as Georgia, by the way, does not have access to that new integrated SEP. Here we also have the simple plan in New Orleans, and then one for Baton Rouge and North Shore, and then Alexandria, Lafayette, and Shreveport. Again, you can see here with that simple plan, really good dental benefits along with the OTC benefit and our Spendables cards. Here, the opportunities out in Louisiana. Wellcare is the only carrier to offer a mileage reimbursement as a benefit. Also, the only carrier with pay at the pump gas and rollover benefit on their Spendables card. As I mentioned, that's kind of the key thing, again, across the country. Again, as I mentioned, competitive dental across our portfolio with our plans. Access plan is QMB only, so more competitive than in previous years for that level of Medicaid. And then here, as we see, there's a couple competitors, right, that are giving us some opportunity. Aetna, right, not having a PPO, partial Medicaid plan, no implants, no rental assistance, and then Humana exiting a parish out there. So again, Louisiana, a nice opportunity for us. Mississippi, again, this was a nice state this year for us. Again, this plan does not have the integrated SEP, but again, our dual access and dual liberty plans are very competitive out in this marketplace, along, again, with our simple plan, our core HMO simple plan. Again, as you can see here, the benefits that we're looking at in different parts of the state. Out here, one of the key things in Mississippi for this year was really Humana, so a competitor, right, exiting 9 different counties, which helped us along. Also, Aetna was exiting Forest or Hattiesburg and Jones, which is Laurel counties. And then we're the only carrier to, again, offer mileage reimbursement in this state as part of our plan benefits. And again, they only carry with gas pay at the pump with a rollover benefit on our spendables card, along with our competitive dental plans. The other big thing here that we've seen in the state of Mississippi, as I mentioned in Florida with our network, we have over 99% of our network adequacy, which leads all carriers. So a huge, we think a huge competitive advantage when it comes to network within Mississippi. North Carolina. So again, not an integrated DSNP plan state, but again, our dual access, dual liberty leads the way in that demographic, along with our Wellcare Simple plan. Here in the state of North Carolina, we do have a PPO option when it comes to that simple plan, along with the HMO. Here, our give back plan within the state, we feel sort of mid-range. Right, the plan will be competitive plan up against competitors for the reason. One reason is that the give back dollar amount, right, is sort of in the middle of the road, but we include generous ancillary benefits as part of that plan. Other competitors may be offering more on the give back portion, but again, their ancillary benefits aren't going to be as strong as ours. So something to keep in mind when we're looking there for overall benefit that the plan gives to our members. The assist plan, so lots of competitors have removed the NEMT and PERS benefit. So that's the help if fallen can't get up kind of thing, right? So our plans, still offer those benefits. And then with our simple plan, right, a potential win with our in-network MOOP being very low, right? As I mentioned, low copays, low out-of-pockets with our simple plans compared to our competitors. And then lots of competitors have doubled or even tripled their MOOPs on their plans for 2025. Again, dental benefit with not having the preventative costs applying towards the dollar maximum amounts really helps our dental benefits here in the state of North Carolina, as people aren't spending down their dollar benefits, right, to get their cleanings and x-rays done. So South Carolina. So South Carolina was really hot for us in AEP. I included it because it is part of this right southern region. But right now we do have some suppressed plans here throughout the state, which has slowed some sales down. We're hoping to open some of those back up as we get a handle. Right, we just had too many sales, unfortunately, during AEP here in the state of South Carolina. But what we're looking at here, hopefully, as things continue to move along, is our Wellcare Dual Liberty plan, our Mutual of Omaha Simple Open PPO, and then our core HMO Simple plan as well. Within the state, which gave us such a boost here for AEP, sorry. Again, we have the whole state covered. Humana, right, has made some changes to their plans or leaving the state, right, in certain counties, as we see here on the screen. A lot of carriers, right, are eliminating transportation benefits. Again, their all-in-one cards only have food and OTC, again, where ours have the suite of benefits, right? And then we see here also United Healthcare DSNP is leaving a county. So with all the changes here happening within the state, we are looking to be part of kind of the calming force, if you will, right? A lot of our plans from year to year stay, as far as benefits, have stayed pretty even keel or have improved. Also here in the state, we have all major hospital systems. So looking at network, all plans in all counties have a reciprocal network. and state retention specialists. We also have those event opportunities through our community service team that I mentioned earlier. Again, formulary is always a key with all of our plans throughout the country as well. Oops. And lastly, let's take a look at Texas. Texas, again, not one of those integrated DSNP plans, but has been top, I'd say, within the top 3 nationally of all states so far this year. Even not being an integrated DSNP plan state, we're still seeing high numbers come out of Texas because they have a ton of opportunities when it comes to disaster and FEMA SCPs. As you can see out here, we do have some suppressed plans, but again, not really affecting the major areas of Dallas, Houston, down in San Antonio and the Valley. Again, you can see top counties and top plans here. Some of the things that we're looking at in Texas to give you an idea. Again, very strong DSNPs, even though we don't have the new integrated SCP to utilize. Medicaid contract for AEP, OEP, right, has been really good, and we thought we'd see a drop off, but again, with the FEMA SCP doing really, really well out there. So Texas is a nice option. Broker experience enhancements. I wanted to touch base on these. Again, working with Wellcare, we're making it easier to help you guys with what you're doing in your book of business and your clients. So our Centene workbench, right? We've improved that this year. I know, hopefully everyone's done their training this year, but we're unfortunately or fortunately, right, we're getting ready or gearing up to do that again here in another month or so, right? So with us, you can go through and take your AHIP or actually NABIB training for 2026 through your workbench. And again, we have the cost for this year located there. You also have at-a-glance visibility to complete certification status, expanded broker training opportunities through here, and a lot of self-service resources to help you manage your book and your clients through your workbench. Some of the new stuff that we have here, some of the things that you can do. This is sort of your dashboard when you log in. So again, you have, if you're an agency, right, you have the ability to manage onboarding invitations and track those. We have improved support tickets for self-service workflows. So again, if you have an issue, you can use the ticketing system here to help you get those things done instead of waiting on a call and calling in to broker services. So, and again, the ticketing system is 24/7, so can get that done anytime, any day of the week. We have some enhanced reporting when it comes to this, and the ability now for you guys to manage your demographic information all here in your workbench, as well as the ability to upload applications if you're still using paper. If your member needs an ID card, it does give you the ability to print an ID card for your clients. It does allow you to see deeming periods. So again, members that are losing status, right, and they're coming off a plan, you'll be able to see that. Again, we mentioned the extra learning opportunities. You have the ability to make primary care physician changes for your clients here as well. And then any applications that you see, you can follow the process or their status. And this is a big one, RFIs or requests for information on your applications. Again, you can locate those and get us the information to continue that application along to approval. Also, we wanted to let you know we do have an agent of record promise. I know with all the changes happening this year and across the business, right? We wanted to throw this out there. So when it comes to existing clients, if they make a plan change by calling Wellcare directly, you will remain the agent of record. So this means that you'll continue, obviously, to receive renewal commissions on those plan change. Again, if the member calls into us directly. This even applies to plan changes if they're a PDP member and are moving to an MAPD plan. You still remain the agent of record year round. Excuse me. The one thing that, along with this promise, that unfortunately we can't keep here, is we see down at the bottom, is if another active certified contracted agent facilitates a plan change by submitting a new application, right, then that would make them the AOR. So again, unfortunately, we can't hold to the promise when that happens, unfortunately. Broker support and resources. So as I mentioned, FEMA and state disasters here in the state of Florida, excuse me, in Texas, still a lot of opportunity to utilize these SEPs, and we do have a link here to all the active ones that we're looking at. Again, Workbench, how to get to your portal. We have that link, broker support, Health Net and Medicare supplement. So if you didn't know, we do have a supplement available. It's out in California. So again, our Health Net company out there has those. So if you are contracted and selling those, we have that for you. The request for information, as I mentioned, you can do those through your portal, but we have phone numbers here to help along with that. The special POPs for your Medicare, Medicaid eligibility, paper applications if you're still utilizing those. The integrated DSNP tool that we looked at, resource, we have the link here as well. And then our digital resources, so our first look page where you can print off PDPs, different resources available to you is all right here. So questions?
If anybody has questions, you can put them in the chat now for us. By any chance, Ted, will you be sending this deck over to us so we can share it with our agents?
Yeah, I can send it to you if you like, and then I'll let you kind of forward it out however you like.
Thank you.
To everyone. I know you were recording, so you have that as well. Can you tell us a little more about community service team? So Darlene, yeah, great question. So basically what we've done the last year or two, we've developed a new team throughout the markets that their sole job is to work with our providers, community partners, and other opportunities right out in the marketplaces to do grassroots marketing. So they're out there finding events, funding events, again, working with our provider partners in conjunction with them to hold events. So they're a great resource for agents out there that would like to do some of that. Again, they kind of do all the upfront work with finding and setting up and paying for, if needed, the events, but they need agents, right, to work them. So to get in touch with that team, again, as I mentioned, reach out to one of your local managers, and they can connect you with the manager on the community resource team to kind of get you hooked in, right, to what they're doing out in the marketplace. So again, just another lead source that's available to our agents that we're providing at no cost. Do you have an idea about commissions for next year, specifically PDP? Unfortunately, that one is way over my head as far as decision making. I don't. Suzanne. I know this year that was a big pain point for a lot of people. I appreciate all the agents who stuck out with us throughout the year so far. But yeah, I haven't heard of anything. I know the only thing I've heard about next year is that we have submitted our plan bids to CMS. I think they were due last week, so or this week. So our bids are in. So more to come August-ish, right? With our kind of first looks and so forth. Yeah, I kind of find out a week or two before you guys find out when we start rolling those things out. Carol, dental plan in Florida. Did I understand that implants are no maximum limit in Florida DSNP, or is there a limit amount? So yeah, Carol, great question. With that platinum dental plan, there is no max dollar amount, but there are limitations with the plan as far as number of services allowed, right? So a great example that would be, you know, as we see on a lot of dental plans, they allow 2 cleanings per year, right? So same thing with that platinum plan, 2 cleanings. The one that I always laugh at, we can only pull your tooth one time, right? We can't pull it twice. I don't know how that works out, but there's wording in there. When it comes to implant, I believe the limit is they're allowed two implants. So, but you're correct. There is no dollar amount.
Do we have any other questions that anybody wants to put in the chat before we end the call?
And if you guys can't think of one now, again, you'll have my contact information, so you can definitely reach out to me later on if one pops into your head. I'd be glad to help.
Okay, well, I want to thank everyone for attending. And oh, here's another one.
Quite
Oh, it's a
surprised that paying for Uber Eats is covered. Yeah, so again, with the Uber Eats thing, kind of a cool opportunity right there, again, to have store-to-door service, if you will. But just remember with the Uber Eats, as I mentioned, right, the benefit's not going to cover someone ordering a meal through McDonald's or wherever, right, and have it delivered. But they can have their healthy foods from a grocery store or something, right, delivered that way. So yeah, actually my mother-in-law's on the plan and she actually utilizes that benefit a lot because we took away her car now, so she can't drive around, so she has Uber Eats deliver her groceries and stuff.
All right, well, special thank you again to Ted from Wellcare for your great presentation. I want to thank everyone for asking their questions. And in the meantime, if you have any questions or concerns, you can always call our office at 800-662-5080, and any of our marketers can assist you. Once again, this was recorded, and I will send out the information to everyone shortly. Thank you and have a great day. Thank you, Ted.
Thank you, guys. Have a great week.
Bye-bye.
Bye-bye now.